So, ladies and gentlemen, in covering the lower extremities, I'm going to cover up front. I'm going to cover management of a dislocation, fracture, or some kind of bone injury. In my photograph, I had shown a couple items that I had. This is a SAM splint. It is a pliable splint that's designed for immobilization of a bone or a joint that has been injured. It's in this sealed container, and I'll open it up. You can source these on the internet. You just Google SAM, S-A-M, splint, S-P-L-I-N-T, and they'll have it on there. It's fairly long. They have them in a variety of sizes. I like this right here. This is good for a lower extremity or up into an upper extremity. It's fairly thin, as you can see, and it's completely pliable and moldable. It's an aluminum base with a small piece of foam on both sides, so that you don't get wear and tear or something like that. All right, so in this simulation, I'm going to say that I've suffered a fracture. I've suffered a high fracture. About 4 or 5 inches below the knee. It's still there. It's not pushing or protruding through the skin. That's a big deal, because if you have an open fracture, you're looking at the management of potential bacterial infection that can occur. So up front, I have a large ACE bandage. ACE bandages are tremendous. They have two properties that are great. One of them is that they are mildly absorbent, but the biggest property is that they are stretchy. So when you have something that's stretchy, that's great, because you can put added compression on something. So either it's be a wound or a fracture. So if I have a fracture here, I'm going to initiate above just right here, starting right there. And I'm going to stretch it to get it tight, but I don't want it to be too tight. I want to make sure that I can get a distal pulse in my foot, because I'm shooting to put compression on the bone to keep it in place, but not to cut off my distal circulation in my foot and my toes. So if I have a pulse and I can feel my toes, that's good to go. You should always check that before you really start wrapping. Whenever you're doing anything like that, just because you don't want to cause any neurovascular damage in the care of your injury. So just because this is a fracture, I'm just going to wrap down and around. Again, I'm maintaining a lot of pressure on this to get it fairly tight. So my goal is to make a pseudo kind of cast. I want to keep it fairly tight. I want to keep the bones together, because this is going to act as somewhat of a cast, and that's really an ideal thing for a fracture. Even if you didn't have a SAM splint and you had a couple ACE bandages, they're tremendous. I mean, they really work. You can use these little clips here. Since I have them, I'm going to. What you can do if you don't have those is, I'll show you, is you can, some of the ACE bandages have stickiness, some of them don't. What you can do is you can take this and just tie a small knot at the very end. Just a little knot right there. You can find one of the last layers that you went through, and you can tuck this up and under, and that'll stay in there. You can tuck it all the way through that section, and then they'll maintain the pressure and it'll keep it in place. But in this regard, since I'm going to be putting the SAM splint on, I do not want to have this there, because that's just going to be something that's going to be between the SAM splint and my body, and that's going to be added discomfort. So I'm trying to keep my alligator clips and everything away from where I'm going to put my SAM splint, because you don't want to splint something and then have undue rub. Okay, so you guys can't really see how tight this is, but this is fairly tight on my leg. what I'm going to do is check that I have a pedal pulse. You can do that right here on the big toe. You go down, you find the tarsal, and it's going to be on the outside aspect of it. And just put light pressure and you can feel that. Or you can check another pulse back here. All right, I have good pulses, so I'm good to go. So take your SAM splint. So in this regard, I have just enough to get it from here to there. So I'm going to take it and I'm going to start conforming it. To my appendage. All right. Gonna open up another ace bandage. So in my kit, I carry 5 or 6 of these things. I really think that between these and some compressed gauze and a SAM splint, you can take care of the majority of issues that are going to develop while out on the trail, because there's injuries that you can take care of, and there's injuries that you can splint, and then there's some that you can't. We're not in that scope of care here. So, all right, because this is a hard system here, it's got that aluminum base, I'm wrapping this as tight as I can. I have this ace wrap between the SAM splint and my skin, this right here, so I'm trying to get compression. I'm not going to cut off my pulse because this is gonna stop the ace bandage. So, but I want it really tight because I'm trying to essentially immobilize this leg. All right, so I have this secure now. As you can see, goes up, back. So there's a couple things you can do here. Say you have this fracture here, but you have to get out of there. You're stuck. Something you have to walk. This stuff right here is aluminum. It can be cut. If you have a pair of trauma shears or surgical shears, you can cut this. I would not try and cut this with a knife on your body. Do not. That's highly, highly not recommended. But you can cut it right here, and you can don a shoe or something else, or you can walk, or you can cut it right there and say you only have a sock or something like that because you're wearing motorcycle boots, and you can't wear your motorcycle boots with this because it hurts too much. You can take this little sliver section and you can throw it on your foot and wrap it with another ace bandage, and then you have a pseudo shoe that you can use to walk on if you have to for a little bit or something like that. Say you're on a trail and you got to get to the beginning of the trail or something like that. If you find that you have spots here that are rubbing or anything like that, you can take cloth or something like that and use it to fill in the section so you're not creating undue rub or stress or pressure. So that's critical for that. All right, so I've immobilized. I have good distal pulses, and I'm ready to get out of here. I can call for help. I can use my spot locator. I can have someone else get something. I can do whatever I need to do. I've splinted my leg. This is going to make me feel a lot better. And as you saw in my kit, I had a pill container. I carry a variety of pills in there. I carry acetaminophen, essentially Tylenol. I carry something called meloxicam or Mobic. That's a prescription strength NSAID, kind of like Motrin or ibuprofen. It's great for joint and bone pain. That's primarily what they prescribe it for. So if you can get a prescription for Mobic, it's tremendous for fractures or any kind of bone or joint pain. So you can take your dosage, stick to the dosage that they recommend. Even over-the-counter medications are poisonous and high volume, particularly acetaminophen and aspirin. Aspirin's not going to be a big help for this. You really want a particular type of NSAID. So ibuprofen, acetaminophen are going to be your big ones. If you happen to have any other type of pain medication, your via prescription or something else that you carry, you can utilize that as well. But stay within the recommended dosage limits for all that stuff. All right, thank you very much.